We'll hear from Ms. Tamara Bob, the epidemiologist, who will present the current situational report. We will hear from the Minister of Health, Mr. Sinclair Prince, who will tell us about the situation on the ground. Mr. Elliot Samuel, he will speak to the laboratory testing. Dr. Joyce St. John, who will look at the situation as it relates to the region. The representative from PAHO and the Prime Minister, the Honorable Dr. Ralph Gonsalves, he will speak to the national response as it relates to COVID-19. Some ground rules: we will allow all the panelists to make their presentations, and then we will open the floor for questions from the media. Those who have access to microphones, you can raise your hand if you wish to ask a question. I will recognize you. You will be unmuted, or you can unmute yourself. You have that privilege, and you will identify yourself and your media hosts and ask your question. For those who do not have a microphone, please type your information and questions in the chat, as it will also be monitored.
Good afternoon again to all who have joined us this afternoon. My task is to share with you just an update on the COVID-19 numbers since our last release, which was last evening. So since our last report, we have recorded an additional 49 cases of COVID-19 in St. Vincent and the Grenadines. We are still doing some investigation in terms of whether these are imported or local. The majority of them are local cases with no travel history. However, we still have 8 cases where we are investigating whether they are imported or linked to local cases. So this brings our total COVID-19 cases in St. Vincent and the Grenadines to 333. We have 227 active cases of COVID-19. Since our last report, we have not recorded any recoveries, so that number remains at 106. We have not recorded any deaths related to COVID-19. And while I'm presenting, I just want to use the opportunity to give you an update on the dengue situation. Our last report would happen in November, where we had 1,617 laboratory confirmed cases. We had an update just a couple of days ago. We are now at 1,790 cases. So between November's update and our 8th, we recorded an additional 173 cases of dengue. That's it from my end. Thank you.
Okay, thank you very much, Ms. Bob. What is happening in the region, and perhaps she can help us understand the connection, if there is any, to St. Vincent and the Grenadines. What is going on? Dr. St. John?
Thanks very much. Can you hear me?
Yes, I can. Thank you.
And can you see my presentation?
Yes, we can see it.
Okay. So I also want to tell you that the Director of Corporate Services, Dr. Sami, the head of the Caribbean Regulatory System, Dr. Extabor, and Ms. Blackman are also representing CARFO. They will assist with any questions that may come up as a result. So today I am hoping to look at recent developments, tracking COVID-19 in the region, the role of NCDs in this whole thing, as well as an epidemiological update for the region, some discussion on vaccine measures and prevention measures. So these are some recent developments of note. The world learned of 2 new variants of COVID-19, and one of them, the UK variant. This is an evolving slide, so you will see that there's some differences. One of them, the UK variant, has been isolated. CARFA and the University of West Indies St. Augustine campus are involved in a research project where we are looking for the UK and the South Africa. So far we have tested samples from 6 countries, including St. Vincent and Grenadines. But we've only found the new variant in Jamaica. This is very hot off the press. UK and Canada are now requiring the PCR test 72 hours before travelers come in from other countries. And the US will be also requiring PCR and antigen testing 72 hours before travelers come into other countries. So you can get an idea of the need for ramping up the testing. So let's look at the Caribbean and specifically the CARIFORUM member states as a subset of the entire Caribbean in the context of the entire world. And as of Monday, there were 19 million confirmed cases around the world. And let's look in the third column. For the entire Caribbean, there have been over 389,000 cases. But CARIFORUM member states are even less than that. 80,518 confirmed cases among our member states, which include UK overseas territories, Dutch-speaking countries, Belize, and Haiti. And as compared to the rest of the world, we therefore in the Caribbean have been doing a good job of keeping cases and deaths at bay. The CARIFORUM member states have only had 1,571 deaths. And as of January 10th, CARIFOR's medical microbiology lab had received 38,574 samples cumulatively from the start of this outbreak last year from 17 member states, with 13.2% being positive. This positivity rate is much higher than the overall positivity rate because we tend to get samples from groupings where you get more chance of getting positive cases. And I'm bringing you to non-communicable diseases because they're a major public health challenge. And they cause 3 out of 4 deaths in the Caribbean. And what is even more disturbing is that having non-communicable diseases are the risk factors of non-communicable diseases, obesity and smoking. So it is going to be very important that despite all of the work, several of the Caribbean countries have signed on to programs. St. Vincent is in a special group, the AMC group, and they will have reduced rates to pay. And actually we have a meeting coming up this week where we'll be looking for news on what is happening with ANC in terms of procurement. And it's going to be very important to administer the number of doses that the manufacturer recommends. And don't mix and match. You may have a COVID vaccine from Pfizer and Moderna. Take your first dose and your second dose from Pfizer or Moderna. Don't mix and match. And then it's going to be important to have those ring fencing of vaccine safety surveillance. So even after there's vaccination, we need to record the adverse events. So the process of vaccination itself, and here we see a picture of President-elect Biden receiving his first dose. PAHO again is doing most of this preparation for the actual vaccine process. It's one thing to get the vaccine, but the important thing is to get it in the hands. CARFA will support PAHO with communications, with the vaccine regulation that I told you about before. But even though we're focusing so much on COVID-19, again, like for NCDs, it's important that we also focus on the previous vaccine program. And there's some things that I would want that governments make sure of, and this slide is borrowed from PAHO's immunization advisor for the Caribbean region. Don't assume that current vaccine supply chains are sufficient. And don't think that a vaccine is a vaccine is a vaccine. COVID-19 vaccines, some of them are very complex. Some of them need really cold temperatures to be stored. So right now, PAHO is going to give information on how to re-engineer the vaccination program to make sure that the vaccine is delivered safely. We don't want to stop our usual vaccination program because we don't want any outbreaks of things like measles. So it's going to be very, very important that we look on carefully at what other countries are doing and make sure that we learn the best practices and don't make the same mistakes that others make. And at the end of it all, I want you, the audience, to remember that it is really important to follow the public health recommendations. Hand hygiene. Maintain 6 feet of distance, especially if someone in the household is suspected of having COVID-19. Avoid touching your face. Make sure that if you're out and you have to cough or sneeze, don't cough and sneeze in everybody's face. Have your cough and sneeze etiquette. Use a tissue that you discard right away or cough into your elbow. If you're feeling sick, don't come into work and make everybody else ill too. So, know when you're not feeling well and need to seek medical attention, especially if you're having difficulty with breathing, and seek that attention early. And avoid gatherings. So, Madam Chair, thank you very much for the opportunity to address you and give you the perspectives. Oh, I see Mr. Sam.
Thank you very much.
You're from him now.
Yes, thank you very much, Dr. St. John. Mr. Samuel is indeed there with us. He had some technical difficulties, but he's there, so we will go to him now as he speaks to us regarding the testing at the laboratory. Mr. Samuel?
I just want to give you some figures in terms of the number of tests that we have been processing at the laboratory. Our test numbers are now hovering just around 24,000 PCR tests, and these have been the numbers of tests that we have been doing since, or we have done since we began our molecular laboratory at that new site. In terms of our diagnostic capacity, we are now looking, well, actually when we started, our capacity hovered around processing about 300 samples a day, and we are now doing, on many instances, around 500 samples per day. And these include persons who are coming in for exit screens, the flights that we're getting that we have to do entry screens on, as well as the public health cases in terms of the suspect cases and the contact tracing. This brings me to a much, I don't want to say heated debate, but some issues that we've been having recently in terms of our ability to turn out results at the laboratory, where we are experiencing some delays in terms of being able to give people their results in that 24-hour time span. Now, what has been happening is that we have been experiencing where the amount of samples that is coming into the lab is far exceeding the capacity for us to turn results out 2 weeks or so. And today I'm happy to say that having done some much needed intervention and relooking and revisiting our process, I can say that we have caught up with the backlog, and as of today, we are closer to processing all of the samples that we have in lab. I know just about 2 days ago we had reported that we were about 921 samples behind. As of last night, we were able to bring that deficit down to about 394 samples that are not in process. The staff, as we speak, are at the laboratory processing all of those samples, including all the samples that were collected yesterday. So by the end of today, I think we can say that we have caught up on the backlog and we'll be able to focus on the samples that will be coming in on a daily basis. In terms of, I know persons are interesting to know if we can keep up with the surges in testing. And last year we would have procured reagents and supplies to allow us to do just about 35,000 PCR determinations. And we have since ordered new reagents, supplies, consumables to allow us to do an additional 25,000 tests. Those reagents and consumables are en route to St. Vincent. I know persons are experiencing many challenges where acquiring resources for testing is concerned. We do have our challenges, but the very important things we do have on the ground, and we have been lucky enough to have suppliers who can meet our demands. We're actually expecting some critical supplies in the country in about a week or so. So we have not gotten to the point where I can say that we are short on laboratory supplies. I want to also talk a little bit about the exit screens. Because of the increase in demand for the public health cases, we have to sort of shift our focus to testing and identifying persons in the community who are positive and to really get an early handle on those cases. So we are urging persons who have exit screens to make your application to the coronavirus task force early, so you can have those samples taken and your test can be in lab at least 72 hours before you travel. So I don't want to say that we will not get you a result, but it's going to be increasingly difficult if you are getting your sample taken in less than 72 hours. So my encouragement here is to have persons who are traveling to get their samples taken so they can get those samples into the lab in a good time frame so we can have those results out. I don't think there's anything else I want to touch on for now. I'll just wait to see if there are any questions regarding lab services.
All right, thank you very much, Mr. Samuel, for that update. And at this time, we will hear from panel and WHO representative, Dr. Rufus Ewing. Dr. Ewing?
Yes, Dr. Maybe I will start.
Okay, thank you very much, Ms. Richards. My name is Dr. Pierre. I'm the representative for WHO for Barbados and Eastern Caribbean countries. As Dr. Ewing mentioned, I will start and pass on to him to share some of our contributions. So thank you very much again for the government of St. Vincent and Grenadines to include our participation. Protocol is observed, and I would like to go quickly to share with you why we are here and then what we will be contributing towards the effort and the response in St. Vincent and the Grenadines. Please allow me to start first on the COVID-19 pandemic because the public health issue in St. Vincent and the Grenadines is not only COVID-19. I'm very happy that Dr. Joyce and Jones mentioned also NCDs and also the impending volcanic eruption, and then the impact in public health also will be an issue. As mentioned earlier, a year ago, the world was warned of the outbreak of new coronavirus, and today we have reported over 91 million cases, and then unfortunately 2 million, nearly 2 million lives been lost. Our countries in the Eastern Caribbean were also affected, and especially in the last 3 and 4 weeks, we have seen and experiencing a second wave and a second peak of this outbreak. PAHO and WHO have developed and shared with countries a comprehensive packet of general guidance on surveillance, laboratory testing, infection prevention and control, readiness checklist, and risk communication and community engagement. Our support to the countries has been primarily focused in 3 main areas: to save lives, protect healthcare workers, and stop the spread of the virus. The details will be presented by Dr. Yui. Currently, the current outbreak is not different than what we saw last year. The virus that caused COVID-19 infection mainly spreads between the people who are infected and persons in close contact with another person. Transmissibility of the virus not only depends on the amount of viable virus being shared and expelled by a person, but also the type of contact that each of the persons may have, the settings, and what prevention and control measures are in place. I think Dr. Joe St. Johnson mentioned some of those areas. Please allow me to share with you this slide so that you have a better understanding of what we are talking about when it comes to the control of this virus. So the public health measures are actually taken to the 3 areas: to slow and stop the transmission, to prevent outbreaks, to provide and optimize care for all patients, and then maintaining and minimizing the impact on the health systems. So at this point in time, what we have to look at that the infected individuals have highest viral load, meaning that they are more infectious just before or around the time they develop symptoms, which will be during 5 to 7 days. The COVID outbreak over the previous weeks are related to people attending crowded settings, engaging in confined spaces, and limited physical distancing and not wearing masks in public spaces. Therefore, as Dr. Joyce St. Johnson mentioned, it's very important to practice those kind of public health and social measures to prevent the outbreak. The current intensity of transmission and response capacity of the health system, as the laboratory technologist and the person mentioned in St. Vincent and the Grenadines, require the adjustment of the public health and social measures tailored to the local context and stepping up contact tracing, case finding, identifying, isolation, and quarantine as the need requires. Some of the public health measures you may see in this particular slide. And the next one is that about the so-called avoiding the 3 C's. The 3 C's are crowded places, close contact settings, confined and enclosed spaces. These are very critical. That's why we have outbreaks if we are not protecting ourselves through this kind of measures. We are now in a very dangerous time in the course of this pandemic, and we do not want to see people become complacent as vaccines are starting to roll out. We are not actually there in the Eastern Caribbean, maybe 2-3 months away from the vaccines, unless otherwise we get a heads up. Since the start of the new year, PAHO has shipped additional rapid antigen testing, personal protective equipment to the countries, and then we are delivering some more test kits and PPEs to St. Vincent and the Grenadines. We reiterate that local communities, visitors in St. Vincent and the Grenadines to exercise safe COVID-19 personal protective measures. That's very important to look at. As mentioned earlier, there are at least 9 different protection measures we have to look at. So before I just close and then pass on to Dr. Ewing, let me also add a little bit about the La Soufrière volcanic activity and the impact and the relation with COVID-19. It is important to provide essential technical and scientific information to the public, and also the relationship with COVID-19 when people will be in closed settings and confined spaces like shelters. Therefore, we have to look at that as well. In collaboration with SDEMA, CARPA, and other regional entities, we will be providing these double health problems and challenges if this may happen in St. Vincent and the Grenadines. We will work with all parties to identify the volcanic risk factors that affect health, reorganizing the health systems, work to improve preparedness and response, the public health measures needed in that regard, evacuations and the risk areas to be identified very well, strengthening the health systems, defining the patient and referral flows, support epidemiological surveillance, as also important to work on clinical services as it may be. We all know that 2020 was a challenging year. We do have hope for 2021. Thank you very much. I may ask now Dr. Ewing to provide additional information. Back to you.
Thank you, Dr. Gabriel. And as Dr. Gabriel would have iterated earlier, PAHO's mandate is to provide technical and financial support to its member state, this includes St. Vincent and the Grenadines, to strengthen the country's health system and support access to quality health services. At the beginning of the COVID-19 pandemic, PAHO led an in-country mission to St. Vincent and the Grenadines. But prior to that, we held virtual meetings with the Ministry of Health to review the capacity of St. Vincent and the Grenadines to respond to COVID-19 and provided support based on a gap analysis which was developed and supported the St. Vincent and the Grenadines COVID-19 response plan. Since the start of the COVID-19 pandemic, PAHO has committed funding in the amount of close to $500,000 to provide St. Vincent and the Grenadines with equipment, supplies, technical support to strengthen the coordination of COVID-19 response, to enhance risk communication and messaging about COVID-19, and to enhance surveillance in the communities and points of entry, increase laboratory testing capacity for COVID-19, to ensure protection of healthcare and frontline workers through infection prevention control equipment and protocols, and the provision of equipment and supplies for clinical management of patients with COVID-19, while at the same time ensuring the maintenance of essential health services such as NCD programs. But also to build capacity to respond to other health challenges such as dengue outbreak that is currently ongoing. So PAHO provided the technical support initially through that in-country mission, providing technical support and guidance for the organization of the health services to respond effectively to COVID-19 with rapid response teams, to provide technical support with the development of isolation facilities, both at the Milton Cato Memorial Hospital as well as Argyle Isolation Center. We also provided training to healthcare workers and hospitality workers, nursing students at the college, and infection prevention control measures to reduce the risk of infection among frontline workers and them becoming infected. And we noted that even now, not only in St. Vincent and the Grenadines, but throughout the Caribbean, there are increasing number of healthcare workers who are becoming infected, and that is a bit of concern because it may suggest some amount of complacency or need for retraining and reminding persons of the need to continue to keep their guards up. We also supported St. Vincent and the Grenadines with the development of risk communication messages to reduce the transmission of COVID-19 and dengue. During our mission in country, we held meetings with both the constabulary forces, the nursing fraternity, persons in the Grenadine Islands of Backway, and also messages during television programs, also to ensure that persons in the public adhere to the tried and proven public health message to protect yourself and others from contracting the virus. We provided laboratory equipment for the establishment of the COVID-19 PCR testing capacity, first at the Milton Cato Hospital, as well as the secondary site, I think, which is now doing most of the PCR testing that Mr. Samuels alluded to earlier. We also provided the training necessary for personnel, for the personnel in the various laboratory departments for PCR testing. And we continue to provide, as Dr. Debray stated earlier, ongoing support with the provision of high demand laboratory test kits and reagents that are needed and swabs that are needed to perform all of these tests, particularly during this time when the number of cases is going to increase. We also, one of the items that we continue to provide is personal protective equipment for healthcare workers and biomedical equipment to ensure that the isolation centers in the hospital have equipment for effective treatment of persons infected with COVID-19 in both isolation facilities and the polyclinics, and also providing this also for dengue, because some of the equipment that we provided, such as the dialysis machines, increasing the dialysis capacity to support dengue patients who end up having renal failure as a result of dengue infection. We also continue to provide support for COVID-19 surveillance and other public health measures such as contact tracing, the quarantining of exposed persons, and most importantly, but often forgotten, the provision of mental health and psychosocial support to the response team, including the hotline workers. So while St. Vincent and the Grenadines is now experiencing an increase in the number of cases, and as Dr. St. John mentioned earlier about St. Vincent cases being 224.4 per 100,000 population, and when we compare it to others in the region of the Americas, we are doing exceptionally well. But it is still no time for us to let our guards down. COVID-19 still presents a significant threat to both life and livelihood, as we are all experiencing now within the Caribbean or tourism-based economy. And so there's no time for national or personal complacency, letting our guards down or not paying attention to the proven public health strategies such as hand hygiene, wearing of masks, especially in those conditions of the 3 C's that Dr. Debray mentioned, and maintaining physical distance. Healthcare workers adhering to the infection prevention control procedures that they were trained and what to follow. We also continue to provide support in very important public health strategy, and this is the mainstay of control and containment of COVID-19, which is tests, contact tracing, treating individuals who are infected, quarantining those who are exposed, and isolating and treating those who are infected with COVID-19. And that is really the mainstay, those significant measures of control. And so PAO will continue to provide support to St. Vincent and the Grenadines to build capacity for the implementation and maintenance of these public health measures, to reorganize the health services where necessary to do so, particularly in the context of other disasters such as possible volcanic eruptions, or amidst in the context of outbreaks such as dengue fever. So we'll continue to provide the support that is necessary for St. Vincent and the Grenadines to respond appropriately to protect lives and livelihood, and to protect our healthcare workers so that they continue their good work. Thank you very much.
Right. Thank you very much, Dr. Ewing. Thank you for that update. And I note that we have been joined by the Honorable Prime Minister, Dr. Abdullah Saf, and the Honorable Minister of Health, Mr. Sinclair Prince. I want to say welcome to both of you. And at this time, I want to give Minister Prince the opportunity to speak to us regarding the situation here on the ground in St. Vincent and Grenadines. Minister Prince, good afternoon, welcome.
Good afternoon to everybody. But this press conference, this briefing is really for us to get an idea as to some of the technical issues involved. And it's only left for me to say that I thank all of the players involved, all of the persons who have been working on the front line, all the persons from the administration, the government, the cabinet, everybody, CAPO, CAFA, for the tremendous amount of goodwill and effort that they put into this particular fight against the pandemic. The government will continue to work, the Ministry of Health in particular, will continue to work strenuously to ensure that the populations in Vincent and the Grenadines remain safe. We appeal to our public to do all they can to ensure that the protocols are adhered to and that we may not suffer any more adverse effects from this pandemic. Of course, we'll continue to update you on what the ministry has, what government has in respect to this. We'll continue to do so on a timely basis. But for now, I just allow the others to come in and say their part.
Okay, thank you very much, Minister Prince. All of the others have made their presentations, and we will hear from Prime Minister Dr. the Honorable Ralph Gonsalves. He will give the national response to the COVID-19 situation here in St. Vincent and the Grenadines. Dr. Gonsalves, good afternoon and welcome.
Thank you very much, Jennifer, and good afternoon to everyone. And I want to greet especially my dear friend from CAFA. Joy, I didn't hear you because I was involved in another activity. You know how it is. But I heard you yesterday at the CARICOM Heads of Government meeting. No, not yesterday. Yes, yesterday. Anyway, I heard you recently. I hear you so often, Dr. St. John, that it's as though you're with us all the time. And we're very happy to have with us the PAHO rep and Dr. Gabriel and PAHO WHO rep in our area. My old friend Rufus Ewing. I see you having elections coming up in Turks and Caicos. You're not in the contest this time. For those who didn't know that, he was the head of government in the Turks and Caicos some time ago. So we met at the Heads of Government conference. I want to thank all the members from the Ministry of Health. I didn't hear Tamara Bob either, the epidemiologist, or Elliot Samuel, the chief laboratory technician. I want to repeat something which I talk about very often, is that the fight against this pandemic involves us having a plan. And we have, first of all, a national multi-hazard health plan. We have an infectious diseases plan, and within the framework of the infectious diseases plan, a specific plan addressing COVID-19. And then we have an approach which links with the region through the Caribbean Public Health Agency, and in the hemisphere with the Pan American Health Organization, and globally with the World Health Organization. And work within the framework of these plans and with these institutional arrangements. And at the domestic level, at the national level, something which has served us very well is to launch our work through NEMO, the National Emergency Management Organization, and the law establishing that body. And in particular, to have the fight against COVID be driven by the Health Services Subcommittee in NEMO, which is chaired by the Chief Medical Officer. The important functions to be performed, and therefore appropriate structures must exist for these functions to be performed. And of course, we have enhanced our testing capacity. We have 22 flu clinics across the country. It's a small country, across 9 districts. And then of course, we have the supporting facilities of the hospital and our isolation facility at Argyle. We have updated our law in relation to public health. On April the 7th, we passed important amendments to the Public Health Act, brought it up to date, modernized it, and all of these efforts are directed to fighting this pandemic. It is important for us to appreciate too that we have developed a good leadership. Leadership is important in this fight. And we have an excellent technical leadership in the Chief Medical Officer, the Medical Officer of Health, Dr. Roger Duncan, the Director of NEMO, Michelle Forbes, the Health Disaster Coordinator, Donna Bascom, the Health Information System Coordinator, Lisa Llewellyn, Infectious Control Specialist, Dr. Jose Davey, the Community Health, the Senior Nursing Officer, Community Health Service, Assistant Julie Russell, the Health Promotion Officer, Shanika John, and Tamara Bob, the epidemiologist, the laboratory testing, the Hefe, the Chief Laboratory Technician, Elliot Samuel, and then of course the staff spread across the country, because we have sought to focus on boots on the ground epidemiology, testing, contact tracing, and public buy-in, getting a consensus. So for instance, we have not done like some other countries to make the wearing of masks mandatory, but it is highly recommended. And you go about Kingstown now, because there's an uptick, you will see 90% of the people wearing masks. We don't think that legislating to penalize the wearing of masks is going to either help law or law enforcement or the pandemic, help us in fighting the pandemic. We get the public buy-in, and we are disciplined people overwhelmingly, and people listen to what is happening, and they're taking sound advice and acting accordingly. And we have seen this from the very beginning. We didn't get ourselves involved in states of emergency or curfews because we considered appropriate to our circumstances, not to other people's circumstances. And I'm very happy to hear what Dr. Bieber said in this regard. We fashion solutions, even though they're universal principles, they have to be applied with a particularity, taking into account all our circumstances. The government is committed and has been committed to providing resources, and even at the short notice. Like for instance, 2 weeks ago, the Chief Medical Officer said we need some more nurses. We provide 13 or 16 set nurses additional. We wanted another lot. We organized to get another 23 nurses. They're in the process of being appointed, and so on and so forth. And we have added a lot of the nursing staff to the staff on the ground. We have an uptick throughout this whole pandemic since March 11th. We have to keep a patience and a calm. We don't have to panic. The situation is not overwhelming the health authorities here and our support systems externally. When we didn't have our testing up, and Tahoe Health and CAFA Health and the Regional Security System Health. In other words, there are institutional arrangements for us to bring together all the requisite resources. Now we are coming at the point where, in addition to what all we have been talking about, wearing of the mask, originally the WHO didn't quite have a clear position on that. But it has become accepted that everybody must wear the masks. It's better to do so than not to do so. The hand sanitizing, the physical distancing, social distancing that is called in some places, and for us to establish the controls at our point of entry, and to have our security forces work closely with the health authorities. And that's from the beginning we identified this awesome challenge, having 4 interconnected dimensions: health, economic, the social, and security. Of course, in the social it includes the issue of education, and having to do education online, training online, and also strengthening the social safety net and the like. And we presented a special, a supplementary estimate on April the 7th to strengthen the resource base to fight this pandemic. And we have done reasonably well thus far, but we cannot be complacent. At the same time, we must not be hysterical, and we must have always a sense of balance in handling this matter. We always said that our approach is such that when it is necessary and desirable for us to ramp up any set of restrictions or alter the protocols, we do so. If we have to lower them or scale them back as the circumstances demand or admit, we do so. And we have had experiences with all of these over this period since March the 11th. There are altered circumstances, and we have to, at the moment, with the uptake. And I asked our people to realize this. You have a plan, but it must have flexibility, because there are some randomness which will emerge. There are uncertainties, all of which you cannot quantify or reasonably foresee. There are risks. But all this is part of life and living. And we have to live well with COVID. And we have to apply our science and our hearts to wisdom to make specific decisions and to shift as the case may be. You take, for instance, Britain, Britain said in order to get back into the country, you have to have a PCR negative test. On the 26th, that is going to be the case, 26th of this month, the case for the United States of America to enter in the United States. This puts additional pressure on our testing capacities for the exit screening. So we have to ramp up our work. I didn't hear Elliot Samuel speak to this, but I know that he would be working on this, and I get reports from the Chief Medical Officer. By the way, I speak to the Chief Medical Officer several times per day, beginning at 6 o'clock in the morning and going late into the evening, keeping in track all the time what is happening, and so that I have a channel with the technical area of this work. And I speak to Michelle Fox of NEMO. So I want the public to understand that there's a great deal of coordination going on. Thank God we haven't had any deaths, and a couple of persons have gotten particularly sick, but with pre-existing conditions. And the entire team, they've been working together pretty well. That errors have been made, that the ball has been dropped here or there on this or that little particular, well, there's not perfection this side of eternity. We get perfection when we go to what the preachers call Beulah land, when we go into the heavenly city. We have to work with all kinds of contradictions and problems and challenges. But the proof of the pudding is in the eating, and we have done with all of these institutions and all of the personnel, and with the resources and direction provided by the political directorate, and critically, the buy-in, the support, and the discipline of our population as a whole. Doesn't mean that we don't have elements of real discipline. I don't want to make us look perfect, because we are not. But amidst all our imperfections and limitations, we have been able to pull this fight together. I know that in the testing, we are having, I know some outreach is being made to some private sector labs to see how we can work that out, particularly for persons who have to do the exit screening. No vaccines. On the 26th of September, I made a speech to the General Assembly of the United Nations. I said that I feared that with the vaccines, where it is necessary that we have equity in distribution and affordable vaccines, that we have to do many things so that we don't end up in a world where only rich lives matter. Rich lives meaning rich lives in the sense of rich countries, and also rich individuals within countries. Thankfully, the WHO and other international entities, including Gavi, the Global Alliance of Vaccine and Immunization, working together with PAO and with CAFA. And the COVAX facility has evolved. But I feared that even the good work of WHO may not be enough for us to stem this selfishness by some rich countries wanting to hog all the vaccines. And this is something which CARICOM yesterday at the heads of government meeting, we are calling for a summit on discuss them. I know WHO is saying by the end of March, beginning of April. I've been telling people that I hear that, but the way I see things, we're not going to get our 20% of the population of St. Vincent, the vaccines for them by that period of time. I don't know if it's going to happen by June, because of certain facts, which but they themselves are very concerned that we are not having it doesn't look as though we'll get the kind of distribution that we ought to have. And we in CARICOM, we're raising this as a very critical issue. And I know that Dr. Joyce and John has raised this, the chief medical officers have raised it, I know that PAO and WHO representatives have raised this, and it is something which we have to continue to push, those of us. There's a market failure really, because our markets are very small. And there are other candidate vaccines other than those like Pfizer and Moderna, and we know about AstraZeneca. There are vaccines from Russia, they're from India, they're from People's Republic of China and other places. And we have to get these authorized where they comply with all the requisites for the standards of authorization, so that our people can get the vaccines. Not just those in the COVAX, but what we may have to purchase beyond the COVAX facility. So I think this is a very important question as we go forward. But again, The vaccination is not a panacea. We have to be careful, and for quite a while in living well with COVID, to deal with the here and now, the masks, the contact tracing, the testing, the hand sanitizing, the physical distancing, boots on the ground epidemiology, all the various elements which persons have spoken about before. And I want to reiterate as I conclude the profound thanks of the government and people of St. Vincent and the Grenadines to the World Health Organization, to the Pan American Health Organization, to the Caribbean Public Health Agency, to the Regional Security System, to the Caribbean Disaster Emergency Management Agency, and all other supporting the regional, hemispheric, and global agencies assisting us in this fight, which is one for the whole world. And I want to thank yet again the leadership in the health sector on the ground and all the frontline workers, the boots on the ground, epidemiologists, and most of all, to thank the people of St. Vincent and the Grenadines for listening to the respective authoritative voices. Thank you.
Thank you very much, Prime Minister. At this time, we want to thank all of our presenters. You have given us quite a lot of information to process, and we are going to give the members of the media an opportunity to ask some questions. Just so the members of the media know that some other members of the technical team are on this press conference. Chief Medical Officer, Dr. Simon Kizabich. We have the MOH, Dr. Roger Duncan, Ms. Michelle Forbes, she is on. Ms. Donna Bascom, the Health Disaster Coordinator. The Health Information, that's the Ms. Lisa Spratt. She is the Coordinator of the Health Information System. And we have Dr. Josie Davey, she's also on, and the Senior Nursing Officer of Community Health, as well as the Health Promotion Officer, Ms. Shamika John. So quite a large number. The team is there, and they are also available to answer questions if you have specific questions for any of them. So members of the media, if you have a question, you can please indicate, unmute your mic, tell us which media house you represent, and give us your name and ask the question. We will try to point them in particular direction as we hear them.
Hi, good evening. My name is Kenton Chance of Eyewitness News and Caribbean Media Corporation. I have a few quick questions. The releases that the Ministry of Health has been sending out over the last few days, since late December, it says that the local cases are under investigation. Has the investigation into any of these cases been concluded, and how long do we foresee this investigation taking place? That's one question. Should I ask them all?
Kenton, how many questions do you have? Because
I probably just asked two out of respect for my colleagues. The other question I'll ask though, I think there needs, the government has said that outside, in terms of large gathering, that outside of the big shows that was scheduled to be held towards the end of the year, the other quote-unquote large gathering is churches. But there seems to be some confusion about what churches can do. I know NAMA said specifically in a release that the church attendance should be limited to 10. But I listened to some comments by the Prime Minister this morning. I don't know if that constitutes a revision, but there is a suggestion that there is some discretion depending on the size of the auditorium in the respective churches. So can we get some clarification on that? Those are the questions I would ask. I will mute my mic and listen to the answers.
Very much, Kenton. Can the CMO ask this for the answers to us?
Hi, Hi, good afternoon, good evening, and thanks again to all the participants. Thanks to Kappa and Paho and the team, Prime Minister. So I would take the first question in terms of the cases under examination, investigation. As we mentioned last week, we had identified about 5 different clusters, including churches and some workplaces. We still have some places, some persons that we cannot do a direct link to, but we are still working. We also have some reports, some evidence that some persons who came in and did their 5-day quarantine and completed their 5 days in the hotels, went into the communities and might not have complied with the complete 14 days in the homes. We also have evidence of persons, known positive cases, who, because of our protocols here, we allow stable persons who are positive, and as you can imagine, where we have over 100 positive cases active now, we allow persons, if we deem the home environment to be appropriate, we allow them to isolate at home. We have credible evidence of at least 3 individuals who did not strictly stay within the isolation rules in terms of entertaining persons and in terms of interacting with persons outside of the home. So we are working on those links, but as yet we will not conclusively say that we have identified direct input link with all of the cases. So that's where I'll go with the investigations. In terms of the large gatherings, the press release we sent out did not, on my recollection, limit the 10 and 20 and the 10 inside only to churches. We did specify that we did identify that the mass gatherings protocol, the advisory included churches, but it was not that it was unique to the churches. And this was something we implemented last week. It went from from last Friday to this Friday, and it was specifically because of the need to increase our controls and decrease the likelihood of large group events. So it is not necessary that we will focus specifically on churches, but it was with the understanding that churches are often sites of large gatherings, and we know from experience elsewhere, and unfortunately from experience here too, because of the nature of some of what happens in the church. As you are worshiping, you are singing. And you are singing oftentimes without, it's difficult to sing in your mass, and when that happens, a lot of the air gets shared a lot, and whatever might be there might be shared. Also, there might be hugging. Yes, you might have the potential to physically distance, but there is still the risk when we get into such an environment. So it was not that we were targeting the churches, but rather that we were aware of the risk involved when we deal with churches. Okay?
Wondering whether, if I may say something, because Kenton correctly spoke about something which I said today on my program on National Broadcasting Corporation Radio. First thing to note about what the Health Services Subcommittee of NEMO puts out. It has put out an advisory, a highly recommended advisory, that you have 20 outdoors and 10 indoors. Clearly, there is not a uniformity in terms of space for particular churches. So that if you have a church as large as the Methodist Church, and I use that as an example, where we know there are 4 large quarters downstairs, and there's there's a mezzanine, there's a wing at the top upstairs. If you have the pilgrims who are worshiping come in, the register is taken off them. They have their telephone numbers. They're wearing masks. They do the hand sanitizing. If you have, Kenton, 10 persons in one of the 4 quarters, there's enough space that they can spread out very far. The same thing, another 10 upstairs, they can spread out very far. Nobody's going inside there because it doesn't lock. Nobody's going inside there to lock up the pastor to say that you're having something which is illegal. We have been building this not in a narrow legalistic sense. We have been asking people to apply their common sense, and the chief medical officer has been given sensible advice. There are some churches which are, to put it in local parlance, 2 by 2 in terms of the size in the church, where 10 persons would be a number which you may well have a problem. In some countries, they issue these regulations against churches, for instance. And Simone is quite right, these are not issued about churches, all indoor gatherings. But there's some in our region issued instructions in relation to churches, which came out as statutory rules and order, which had the force of law. We haven't done that. So that people are sensible. And notice what happened. The earlier restriction, the earlier advisory, had the number inside, I think maybe 50 or 40, I can't remember the number. The medical authorities decided they'll bring those down because of the uptick. People therefore apply their common sense and say, what is it at stake here? We must have physical distancing. We must wash our hands, do the hand sanitizing. We must take, for the contact tracing, take the names. Can they do all of those things? And if we do them sensibly within the guidelines, we are going to get good results. If you, on the other hand, see that, listen to me, hand sanitizing, wearing masks, social distance is not a matter of God and should not come into the church. Well, you're wrong, because you are going to get, or likely to get, or more likely to get COVID with that particular frame of mind inside of a small church. That if you have a larger expansive view as that which is advocated by the health authorities, that's the point that I was making. And as you know, always with a sense of balance, that patience and a calm in dealing with this matter. And that is what I was explaining, because if the Ministry of Health comes and says, we're going to bring down a hammer, we're going to send people around to look to see if you have more than 10 persons in the church, you'll have rebellion. You have to persuade people. And that is the context in which I was talking, Kenton.
Okay, thank you.
Hello, good afternoon. Good afternoon.
Dale, go ahead.
Yes, good afternoon. Dale, the Soul of the Prince Central newspaper. My question, the last official release
indicated that we now have 6 persons hospitalized as a result of COVID-19. I think it said that 4 were stable with 2 serious. Can we have an update on these persons? 1, and 2, has it been determined whether or not these persons have had underlying conditions?
Okay, I will go again with that. In terms of, we need to recognize patient confidentiality. We are providing this information. So as of now, we have a total of 9 persons admitted to the 18 persons admitted to the Argyle isolation facility, and we have another 4 persons admitted to the Wilson Memorial Hospital. The ill persons, some of them do have pre-existing conditions, and as that increases the likelihood of complications. We have 2 persons who have pneumonias, COVID-related pneumonias. I'm sorry about the background noise because I'm still in quarantine. So we have 2 persons with COVID-related pneumonias and 1 person who has had what we have concluded is a cerebrovascular accident, which is a stroke. So those are the persons we have right now in care. In terms of the persons at the Argyle facility, only a few of those persons are ill in terms of significant or serious symptoms of COVID. The other persons are there because it was determined that they did not have adequate home isolation facilities.
And my second question, real quick, is more one of clarity, and this has to do with the whole issue of vaccines. I just wanted to have it clarified. It was mentioned last week about the government was looking to purchase a certain amount of vaccines, and of course through COVAX mechanism, a certain amount would be provided. I think in order to say that 70,000 vaccines they look at it to procure 70,000 vaccines for single-standing Grenadines. Can someone just give me what that makeup would be? How many are being facilitated through COVAX, and how many is the government looking to purchase?
Okay, I would go. As Prime Minister mentioned earlier, and as we have said all along, the COVAX facility, and so we have the PAHO reps on. The COVAX facility, the aim was to provide citizens with sufficient vaccine for 20% of our population. But we don't say that as a population of about 110,000, 107,000. So it basically works out to sufficient vaccine for 20,000 persons. We are aiming to have coverage, provide vaccines to between 70 to 80% of our population to allow us to get to the herd immunity that is required. So that would leave 50,000 vaccines for 50,000 persons, the purchase of those numbers. So that is what is the planned for 20% from COVAX, and the 20,000 from COVAX and 50,000 from government finance the resources. However, as we said before, as Prime Minister has repeatedly said, that is the aim. As to the exact availability and when that would happen, that has not confirmed because of how fluid the situation is. Even as we work with COVAX, there's also the opportunity to seek bilateral arrangements with other, with private companies, so directly from the manufacturers. That facility also, that opportunity is also there. But even as we do that, as Dr. St. John presented and as has been presented a while, different vaccines are in different phases of approval. And so our purchasing outside of the COVAX facility, which allows for the approval of any vaccines that we would get, and we would be able to say what level of approval we would want for a vaccine. If we were to purchase outside of the COVAX facility, we would still have to determine what level of approval we would require to purchase a vaccine or procure a vaccine outside of COVAX. And so that is something we are still working closely, and we are going to be working closely with CAFA through their regulatory system.
Thank you very much.
Welcome.
Thank you, Dr. Kizovich. Before we take the other question, I just want to advise that we keep the questions as short as possible so we can get in as many as we can in the next 10 or so minutes. At the same time, we have two questions in the chat. One inquiring as to whether lockdown or curfew is being considered given the spike in the number of cases here, and also whether consideration is being given to making mask wearing mandatory for the entire population.
If I may, I spoke to the issue of the mask, and the person apparently didn't hear me when I spoke about the mask, but so I don't need to repeat that. I think other persons would have heard me. In relation to lockdown, there are persons who say that we must use what they call draconian Chinese methods. I've heard that expression. Lock it down tight like a drum. Now, I don't know where in the Caribbean that has worked. We have a set of restrictions when you come into St. Vincent and the Grenadines. And you can come in, you have to have your PCR test negative, you have to do a certain quarantine, 14 days, at the time it was 10, all kinds of different measures. We just talked about several of the protocols. We are working in our schools are not open. We're doing education by distance, virtual education and training. We have distributed a lot of devices for that purpose. We have some things in respect to the minibus operators. You can't play music in amplified music in public or where the public have access if it's a private place, and so on and so forth. We have a bundle of restrictions, but we don't intend to have a state of emergency so that you can stop a man in Cliff Valley training state at 4 in the morning to get Sprat. Are you going to stop? I hear somebody's mic is not muted.
Yes, Prime Minister, we're having some background noise. Could everyone please mute your mic, please? Thank you.
The lands to change their cattle or their goat. I mean, and the persons, it's easy to say lockdown, but there are certain consequences of lockdown which don't necessarily solve the problem. You open up. The unfortunate thing, the simple thing that many persons don't realize, plants basically stay stand still to get their food, to get it to the roots. Human beings, animals generally, but human beings, you have to hunt, you have to fish, you have to plant, you have to gather, you have to trade, and you may place restrictions, but if you lock it down, you lock it down in civilization. And the question is this: can you achieve the requisite controls on this pandemic while at the same time keep activity going? And that is what we have been doing, and we have been balancing and rebalancing as the circumstances demand and admit. And I think that I come back to this basic thing. And I think as Dr. St. John has pointed out, we haven't done really badly. In fact, compared to a lot of places, we have done, most places, we have done pretty well. But we must not be complacent, and we must not sit on our laurels. Follow the protocols and the important guidelines which are set out. But a teacher came to me and asked me why we don't lock down the place. I said, for how long? They said 2-3 months now. I said, how you'll get your salary? And then there was a pause. Apparently they think that government has a pot of money which they can just print money. There has to be activity, you know, and life. That's why I say this is an interlocking bundle of issues of health, economic, social, and security. Lives, living, production in all their manifold dimensions. Please let us apply our hearts to wisdom and follow the science.
Okay, as news is asking for a quick update on the health of the CMO, the PS to the Ministry of Health and the Minister, as they went into quarantine out of the abundance of caution.
So as an update, we were exposed to a known positive 1 week before the person was determined had a positive test. That was the last real exposure to the person. After that, any interaction with that positive was not considered. It did not meet the criteria to be close contact. So we all had PCR tests done as soon as we realized that we had been exposed previously, and then we had subsequent PCR tests after that. So we all had negative PCR tests. So strictly speaking, on the advice of our infectious diseases specialists, we have been cleared. We have continued to have minimal interactions, however, and I think that is generally what everyone should do. Whether or not you have a known contact with a positive person, it is advisable that you minimize your contact with everyone. And whenever you are in contact with someone outside of your immediate family bubble, you should be wearing your mask. So I'm still working from home mainly. Well, working from home, it seems to be much more hectic because you're in one spot. But that's the update.
Okay, thank you very much, CMO. Anyone else would like to ask?
May I just say, Jennifer, I want to commend the Chief Medical Officer and the Minister and all those involved to have taken the precautionary measure of quarantining, and it provides an example as to how we should function in a sensible and rational manner in these circumstances. As you know, I myself, though I haven't had COVID because I went to America, as you know, for a particular reason, and I came back. I did 14 days quarantine. There are people coming back, and I followed it to the letter of the advisory. The persons who are coming back say they want to get an exemption, they want to come out, I just follow it now. And we do it the right and proper way. We're going to be all right. And we don't need to panic.
Okay, we will take our final question.
Hi, good afternoon. This is Catherine Renton from Searchlight Newspaper. We have 2 questions, if that's all right. The first is, is there a general risk to the public in allowing positive cases to isolate at home, do you think? And the second is, do you have enough medical resources to deal with many more serious cases of COVID-19?
I'm going to ask Dr. Thompson, would you like to take this question in terms of the risk to home isolation? I'm not sure if Dr. Thompson would do that or if he wants me to go ahead. In the meantime, in terms of supplies, we just this morning I was speaking with Mr. Samuel, and I can't remember if he mentioned that. We have had challenges, and that's a worldwide challenge in terms of supplies during this entire pandemic. Supplies in terms of the labs and supplies in terms of the infection prevention and control equipment. And so there is a challenge there in St. Vincent. We currently have sufficient supplies in our healthcare facilities and in storage. We have ordered more. We have been generously helped by PAHO and other non-governmental organizations and the private sector also. That being said, we must be aware of the fact that there is a global shortage and we need to be very careful in the way in which we use our resources. So for now, we are doing extremely strict management of the resources we have. We are pleading with all our healthcare workers and the community in general that we should use these resources carefully, even as we maintain the basic principles of infection prevention and control. In terms of, I'm not sure if Dr. Thompson came back out, in terms of isolation at home, from the very beginning, I'm sure most of you will remember when we had persons who came in from, whether it was persons who traveled away and came back, we have been speaking about what is required for persons who both quarantine at home and isolate at home. Yes, there is a risk involved in that. However, if somebody has in their home an area that they can safely be away from the other persons in the house, there are certain protocols which were developed by WHO, PAHO, which were put out by CAFA also, and we also put out those protocols just in terms of the use of a mask, and that's the importance again of the mask. Use of the mask, hand sanitizing, proper ventilation of the room and the space that the person is in. And that is what we have to aim towards, where we have safe home isolation. The idea of being able to house over, at this point, we have 227 active cases in St. Vincent and the Grenadines. And I'm not sure what country would have the facilities, the capacity to house all of your positive cases. Rather, the priority must be given to those positive cases who are ill so that they can be taken care of. The majority of persons who are positive for coronavirus are asymptomatic. They can stay in their homes, or they might have a very mild illness. They can stay in their homes with guidance. So that is what we are aiming to do.
All right, Dr. Kizabich, thank you very much. I think that is all the time we have for questions today. So on behalf of the Ministry of Health, I just want to thank everyone who joined this press conference. Thank you, special thank you to our Prime Minister, Dr. Ratna South, and our regional and international counterparts, CAFA and the World Health Organization. We thank everyone who joined, the media. Thank you so much. And we look forward to the coverage and to the message.